The bad breath. The kind that makes people lean back when you talk. The kind that lingers in a room after you leave. Because here's the truth. Your mouth is a direct window into your gut, your liver, your kidneys, even your sinuses. And when something goes wrong inside, your breath announces it with odor. The fecal poop dumpster smell. Yeah, breath that smells like actual feces. This is a bowel obstruction. Intestines are blocked. Nothing moves. Bacteria go crazy. Pressure builds. The only way out is up. You vomit fecal matter. And even if you don't vomit, the gases from that backup seep into your bloodstream and out your lungs. Fecal breath is a surgical emergency. If you haven't pooped in over a week, your belly is swollen, and your breath smells like poop, go to the ER immediately. That's a blocked intestine. Also possible, a diverticulum in your esophagus, a pouch that collects food. The food rots. You breathe it out. That's Zenker's diverticulum. Not an emergency, but you'll need an endoscopy. The fruity, sweet pear drop smell. Imagine overripe fruit, or nail polish remover, or Jolly Ranchers that have gone weird. That's the smell. This is diabetic ketoacidosis, DKA. Your body can't use sugar because you don't have enough insulin, so it switches to burning fat. Fat breaks down into ketones. One of those ketones is acetone. You breathe it out. If someone's breath smells like this, and they're also thirsty, peeing constantly, and tired, that's an emergency. DKA can kill you in 48 hours. Go to the ER. But wait, what if you're not diabetic? You can still get fruity breath from starvation ketosis, extreme fasting, keto diet gone too hard. But that's rare. Most of the time, fruity breath equals diabetes until proven otherwise. The ammonia, urine, cleaning product smell. Smells like a public bathroom, or window cleaner, or cat pee. That's ammonia. Your kidneys filter waste from your blood. When they fail, urea builds up. Urea breaks down into ammonia. Some of it gets into your saliva. Some of it goes into your lungs. You exhale it. This is chronic kidney disease, often end stage. If your breath smells like ammonia and you also have swollen ankles, foamy urine, or itchy skin, your kidneys are shutting down. Ammonia breath also happens with a specific gut infection, H. pylori. That bacteria makes ammonia to protect itself from stomach acid. The ammonia backs up into your esophagus, then your mouth. So ammonia breath can mean kidney failure or a stomach ulcer. Which one is it? Check your pee. Foamy? Kidneys. Burning stomach pain? H. pylori. The fishy, rotting seafood smell. Not fresh fish, old fish, the kind that's been sitting in the sun. This is trimethylaminuria, a genetic disorder. Your body can't break down trimethylamine, a compound from choline in eggs, liver, and fish. So you sweat it, you pee it, you breathe it. But fishy breath that wasn't there before? That's different. That's usually bacterial vaginosis in women. The bacteria produce amines that smell like fish. Those amines travel up through your throat. Yes, vaginal infections can cause bad breath. In men, fishy breath can mean liver failure. Your liver normally processes sulfur and nitrogen compounds. When it fails, those compounds build up and come out through your lungs. Fishy breath plus yellow skin, that's your liver screaming. The rotten egg, sulfur, sewer smell. Smells like a fart, or a swamp, or someone struck a match but the match is spoiled. That's hydrogen sulfide, usually from bacteria in your mouth breaking down food. But if your dental hygiene is perfect and you still smell like rotten eggs, that's small intestinal bacterial overgrowth, SIBO. Bacteria in your small intestine are fermenting sulfur-containing foods. The gas diffuses into your blood, then into your lungs. SIBO is more common than people think. It causes bloating, diarrhea, and that specific rotten egg breath, treatable with antibiotics. But here's the scary one. Rotten egg breath plus chest pain and sweating? That's a heart attack. Some heart attacks cause belching and sulfur breath because the pain stimulates your vagus nerve, which messes with your gut. It's rare, but it happens. The sour, vinegary, acidic smell smells like sauerkraut or spoiled milk, or your mouth is fermenting. That's acid reflux. Stomach acid and undigested food splash up into your esophagus. They sit there. They break down. They smell sour. This is the most common cause of bad breath that isn't dental. But sour breath plus a chronic cough, that's silent reflux. Acid reaches your throat and even your lungs. It damages your vocal cords. It gives you bad breath that brushing won't fix. If you wake up with sour breath every morning, prop your bed up. Stop eating 3 hours before sleep. If that doesn't work, you might have a hiatal hernia. The moldy, musty basement smell smells like wet cardboard, or a damp towel, or an old book. This is fetor hepaticus, the breath of liver failure. Your liver can't filter mercaptans, which are sulfur compounds. They build up in your blood. They come out through your lungs. The smell is distinctive, sweet but musty, like a mix of rotten eggs and stale air. If your breath smells musty and your eyes are yellow, that's advanced cirrhosis or acute liver failure. You need a hospital, not a mint. Also possible, sinusitis with a fungal ball. Fungi like aspergillus can grow in your sinuses. They smell musty. You'll also have chronic congestion and face pain. That's not liver failure. It's an ENT problem. But the smell is similar. The metallic, bloody copper smell. Smells like pennies, or a blood draw, or licking a battery. That's blood. Bleeding somewhere. Could be gums, gingivitis. Could be a nosebleed that dripped down your throat. Could be something worse, a bleeding esophageal varices, swollen veins in your throat from liver disease, or a lung tumor that's bleeding. Metallic breath is also a side effect of some medications. Antibiotics like metronidazole, chemo drugs, lithium. But if you're not on those meds and your breath tastes like copper, you need to check for internal bleeding. The yeasty bread dough beer smell smells like a bakery, or a brewery, or bread rising. That's a fungal overgrowth. Oral thrush, candida in your mouth. Common in babies, people with diabetes, and anyone who's taken antibiotics. The yeast ferments sugars in your mouth and produces that bready smell. But yeast breath without white patches on your tongue? That could be a systemic fungal infection, especially in people with weakened immune systems. Or a fermented gut, autobrewery syndrome. That's rare, but it's real. Your gut produces alcohol from carbs. You get drunk without drinking, and your breath smells like a distillery. The chemical paint thinner industrial smell smells like a hardware store, or dry cleaning, or gasoline. This is usually environmental. You've inhaled fumes. But if you haven't been near chemicals, it's a metabolic problem. Some rare genetic disorders cause your body to produce specific volatile organic compounds. Phenylketonuria, PKU, makes breath smell like a musty mouse cage. Maple syrup urine disease makes breath smell like, you guessed it, maple syrup. But the chemical smell that matters most? The one from someone who's ingested antifreeze, ethylene glycol. Their breath smells sweet at first, then chemical as the liver metabolizes it into toxic acids. That's a medical emergency. Before you blame your liver or kidneys, know this: 90% of bad breath comes from your mouth. Your tongue specifically. The back of your tongue is a carpet of bacteria. They produce volatile sulfur compounds. That's morning breath. You can't smell your own breath accurately. Your brain adapts. So do this. Lick the back of your hand. Wait 10 seconds. Smell it. That's your true breath. Or use dental floss between your back teeth. Smell the floss. That's what people smell when you talk.